Do you often feel more tired than you used to, even when you haven't done much at all? Are there mornings when you wake up but don't feel fresh like before? Just heavy, weak, and not in the mood to get out of bed. And then you tell yourself, maybe it's just age. I'm getting older. Of course I'll feel weaker, right? I'm Dr. Kela, and today I want to tell you something important. Tiredness isn't always normal. Sometimes it's your heart sending an early warning sign. Many older adults accept fatigue as just part of aging, but I want you to know there's a clear difference between tiredness from getting older and tiredness caused by a health problem, especially a heart condition. Your body is wise. It doesn't shout, but it tries to whisper when something inside is going wrong. And one of its most common whispers is tiredness without a clear reason. In today's video, I'll help you understand the difference between normal tiredness and heart-related fatigue. Spot signs of fatigue you should never ignore. And most importantly, know when to check your heart so you can protect it in time. If you or someone you care about has been saying, I just feel more tired than before, this video is for you. We all grow older, and yes, with age our energy may drop. It may take longer to recover, and sleep might not be as deep. Because of that, many seniors think feeling tired is just a normal part of life. But this belief can lead people to miss the early warning signs of heart disease. Over the years, I've heard many older patients say things like, I just feel a little weak. Maybe it's because I'm over 60. I used to sweep the floor no problem. Now I get out of breath so quickly. Maybe it's because I didn't sleep well last night. These sound simple, but behind them could be the heart quietly losing its strength. When the heart begins to weaken from clogged arteries, high blood pressure, or hidden heart disease, it stops pumping blood as strongly. That means your muscles, your brain, your entire body doesn't get enough oxygen, and the feeling you get is fatigue. Not from hard work, but a tiredness that lingers, that lasts, that shows up even when you're resting. The challenge is, heart fatigue doesn't always come with chest pain, shortness of breath, or a racing heartbeat. In older adults, the first sign is often just a different kind of tired. A strange tiredness that's quiet, but slowly gets stronger. And the real danger is, we often brush it off. We say, it's just age, instead of asking, is my body asking for help? Understanding the difference between tired from aging and tired from heart trouble is the first step to catching a problem early and getting the treatment that could make all the difference. We all know tiredness is a normal part of life. Everyone has days when they feel low on energy, especially after working too hard, missing sleep, or catching a cold. But fatigue caused by heart problems doesn't feel like the usual kind of tired you've had before. Here are some important ways to tell the difference. When the fatigue shows up. With heart-related fatigue, you may feel tired even when you haven't done anything difficult. Just walking around the house, taking a shower, or getting dressed can wear you out and make you want to sit down. In contrast, tiredness from normal causes, like poor sleep or mild illness, usually has a clear reason and improves with rest. A different kind of tired. Many patients describe this type of fatigue as a deep, draining feeling, not like being worn out after a busy day, but more like your energy has been completely drained. You may feel dull, low, unmotivated, not even interested in food or talking. Rest doesn't help. This kind of tiredness often and then stays, even if you're sleeping well and eating right. You might sleep 7 or 8 hours, but still wake up feeling heavy, not refreshed. Other signs may appear too. Fatigue related to the heart may come with a 2, needs but in the night, and anything spare the same. A real example, I once saw a 67-year-old woman who said, "I'm always tired, even though I'm not doing much." She had already tried vitamins, healthy eating, and a sleep routine. Nothing helped. After an ultrasound of her heart, we discovered she had early-stage heart failure. With the right treatment, 2 weeks later, she said, "Now I finally remember what having energy feels like. If your fatigue feels unusual, unexplained, or different from before, don't ignore it. It could be your heart trying to speak to you." In my years of caring for older adults, I've noticed a pattern. Many people experience obvious fatigue, but they brush it off as just getting older. Here are common situations you may relate to. You sweep for a few minutes and already feel like sitting down. Before, you could and clean the house for 30 to 40 minutes. Now, just holding the broom for a few minutes makes your arms ache. You think, maybe my joints are just weaker now, but the real reason might be your heart not sending enough oxygen to your muscles. Getting dressed feels like hard work. Putting on a shirt, especially one with buttons or long sleeves, feels exhausting. You may even need to sit down to rest halfway. You might think it's arthritis, but it could be mild oxygen shortage in your arms and brain. You wake up already tired. Even after a full night of sleep, you don't feel refreshed. You just want to stay in bed. That's a common sign in people with early heart dysfunction. You feel winded after just a few steps. Walking from your bedroom to the living room leaves you short of breath. You assume it's just your age, but if this is new, only started in the past few weeks or months, it could be something more serious. The common thread in all these examples is this: the fatigue doesn't feel like it used to. It shows up during simple, familiar tasks, not hard ones. But instead of speaking up, many people stay quiet and tell themselves, "This must be normal. I'm just getting old." Growing older doesn't mean you have to feel tired every day. If you notice yourself losing strength faster or unable to do what you could just months ago, ask your doctor to check your heart. Many people ask, "But I'm just tired. What does that have to do with the heart?" The answer is it can have everything to do with the heart. It sends blood full of oxygen and nutrients to every cell, every organ, every muscle. When the heart weakens, 3 things happen. Put simply, if your heart is weak, your whole body feels weak. This isn't the tiredness that comes after a workout. It's a deeper, unexplained, and lasting kind of fatigue. One man once told me, "I don't feel pain anywhere, but it's like someone took the battery out of me. I'm tired even when I'm not doing anything." We checked his heart and found his pumping strength had gone down, and he never realized it. Sometimes it's due to poor sleep, dehydration, anemia, or even a slow thyroid. Other times, it's just your body reacting to a change in the weather. But when fatigue shows up quietly, lasts a long time, and feels not quite right, that's when you should take a closer look at your heart health. You felt tired for more than 1 to 2 weeks with no clear reason, and rest hasn't helped. You feel tired even doing light tasks, like walking around the house, cooking a simple meal, or getting dressed. You wake up already tired, even after a full night's sleep. Your tiredness comes with shortness of breath, mild chest tightness, a racing heart, or a heavy feeling when you lie down. You have a history of heart disease, high blood pressure, diabetes, or someone in your family has had heart failure or a heart attack. You don't need to wait for chest pain before getting checked. Your heart often speaks early, through everyday fatigue. And if you really listen to your body, you might hear it. A woman in her early 60s once said to me that one sentence led us to discover early signs of heart failure. Because she came in early, we were able to treat her and prevent more serious problems later on. Act before your heart has to speak louder through real pain. This can happen to anyone if you don't pay attention in time. Tiredness is something we all feel, but when it's different, lingering, and unexplained, it's no longer something to ignore. Why older adults often confuse heart-related fatigue with simple aging. Pay attention early. You can protect your heart before it's too late. Thank you for staying with me until the end of this video. Thank you for caring about your health. Something many people only start to worry about when it's already serious. If this message helped you, please share it with your friends or loved ones, especially anyone age 60 and older. I'm Dr. Kela, and I'll see you in the next video as we continue this journey together, caring for your heart with knowledge, kindness, and love.